Major fire at a seniors residence in Sioux Lookout earlier this month has highlighted problems in the long-term care system, according to local officials. Although the blaze was limited to one wing of the KDSB facility, nearly a third of the building's 37 residential units were destroyed. Lee Noonan has more.
Although the fire decimated 11 units at Patricia Plaza, everyone was safely evacuated, and some residents have even been able to move back into undamaged units towards the front of the building. Meanwhile, some are still waiting, and others have been placed in long term care or are waiting in the hospital.
The lack of long-term care beds or access to long-term care, the lack of access to extended care beds in our communities also meant that we had seniors and elders in Patricia Plaza who really should be in long-term care.
Some of them maybe have been ready to go to long-term care if it were available or some other care facility. And there's such a dearth of such services and facilities in Sioux Lookout. We need them desperately.
With Sioux Lookout's role as a service hub, Mayor Lawrence says the shortage of long term beds affects the entire region.
We have 1/10 the provincial average of long-term care beds. We have 2/3 of a bed per thousand population versus a provincial average of 6 2/3 beds per thousand population. We absolutely need long-term care, which would have an impact not only on housing, but on our hospital, which is now our acute care bed facility is 50% alternative level care, which is people who need to go into long-term care. So that backup happens in the hallways of the hospitals and in people's homes and in people living in unsuitable conditions or living vulnerably alone in an apartment as a senior.
Wall says the incident has highlighted the need for more investments in long term care and extended care in the north and the need for communities to start talking about supports for aging in place.
That this whole situation has really pulled back the cover on, I think, important topics that communities, especially communities that want to be inclusive, and a community that is going to be kind to its elders and seniors, need to start asking, okay, do we need to have other supports in a community?
There are currently only 20 long term care beds at Sioux Lookout's Minayawan Health Center. A 76-bed extension was first approved under the previous Liberal government, but construction has yet to begin. A request for comment was sent to the Ministry of Long Term Care, who did not reply before deadline. Lee Noonan, TBT News.